Danielle Lawson works in the medical field as a physical therapy assistant. Back in March, she started getting what she thought was a sinus infection. It turned out she had COVID-19.
Felt tightness in my chest when I breathed. Take a breath, and it was hurting. So I went ahead and called, and I actually had to call. I called my doctor, and they denied giving me a test. They wouldn't do it. They said that my symptoms weren't severe enough. But I was really nervous because I work in healthcare and at different nursing homes. So I called in urgent care, and I told them that my doctor wouldn't test me, but I was really nervous about having it and wanted to get tested so that I wasn't continuing going to work and spreading it. And they said to come on in, and I got the results 2 days later. Got the call from the county health that I was positive.
Lawson recovered after a few weeks, which is the case for the majority of COVID-19 victims, but not always. According to Dr. Roberto Colon at Premier Health, doctors have seen the virus cause long-term and permanent health problems even in younger people. Some of these issues can be neurological, ranging from mental fogginess to strokes.
It's now estimated that maybe as many as half of the patients present with symptomatic COVID actually have some form of neurologic manifestations. That doesn't mean that they all have strokes, but they could have some confusion, they could have some mental fog.
Colon said young people with underlying conditions, especially those with COPD, asthma, and diabetes, have been susceptible to more serious issues, such as fibrosis of the lungs. This is concerning since people between the ages of 20 and 29 years old are now the largest percentage of COVID-19 patients in the state.
These are things that we don't typically associate with younger individuals. We would expect to see in the older ones. And those are things that can actually have lifelong effects.
BG Bethel, digital enterprise reporter for WDTN.com.